Hello and welcome. We're now 2 weeks into the coronavirus lockdown, and with just over a week left, the question on everyone's minds: are we winning the battle against the virus or falling back? On the face of it, the numbers are rising and rising fast. We are currently at over 4,000 infected, 4281 infected to be precise, and 319 recovered, 111 dead. The past 24 hours have seen 28 deaths, the highest number of deaths in a single day. Now, if we keep count from the day of the lockdown, the number of fresh cases every day is rising and rising fast. Let's put that graphic up on the screen for you. From 52 a day on the 24th to close to 700 this morning. So there you can see the cases rising every single day, adding 500, 600, and now we've reached 704 as of the past 24 hours a day. Crucially, the rate at which cases have doubled have increased. If you look at that graphic, at the doubling rate and how the doubling rate is rising, the doubling rate has risen in the past 8 days. From 6 days, cases are now doubling every 4 days. Let's explain that to you. Let's break it down. March 15th to 20th, this is after we crossed 100 cases, cases doubled in 5 days. Then March 20th to 23rd, they doubled in 3 days. Things had gotten worse. 23rd to 29th, things got better. They doubled in 6 days. But from March 29th to April 2nd, things got worse. They started doubling in 4 days, and from April 2nd to today, they continue to double in 4 days. So things in the past about 5 to 6 days have gotten worse. Moreover, the disease has widened its spread to 288 of India's 736 districts, so a little under half of all districts. But authorities and experts continue to not be overly alarmed, some experts at least. For one, officials claim that the big surge is because of the Tabligh Jamaat cases, which accounts for almost 1,500 or close to a third of all cases. Without the Tabligh Jamaat, the doubling rate would have been every 7 days and not 4 days, a government official told the Indian Express. Number two, why some experts and the government doesn't seem to be too worried. The case seems to be concentrated only in a handful of states. 6 states account for about 65% of all cases. Maharashtra leads at about 750 cases. Let's put that graphic up on the screen for you. Maharashtra leading at about 750 cases, followed by Tamil Nadu, Delhi, Telangana, Kerala, and Uttar Pradesh also. These are all states which have over 300 cases each. So they are 60% of all cases. To zero down even further, 67 districts have reported 75% of all cases. So all the cases in India, 75% are concentrated in 67 of about 700 districts. Also, the mortality rate in India, again, while it's rising, is low compared to the rest of the world. Let's look at those numbers. Now, if you look at that, with countries with over 4,000 cases, Italy 12%, UK 10%, Spain about 10%, Iran just over 6%, China 4%, USA 2.9%, Indian mortality rate, that is the number of those who died as a percentage of those who are infected, only 2.7%. But of course, persistent questions remain over whether India's numbers compared to the rest of the world are low because of India's low testing. India has increased testing. It's jumped almost 10 times in just over 2 weeks. We were testing at about 1,000 tests a day to around 10,000 tests a day. As testing increases, the rate of those who test positive has also increased from about 4% to just over 5%. If you look at that graphic, it gives you those numbers. So when we were testing about 1,300 a day, it was 50 found positive, 3.8% was the rate of positive. Now we're testing almost 10,000 a day, positive 505, it's jumped to about 5.4%. Even with this increase though, we still aren't testing enough. If you look at the rates per million of countries that are testing, look at where India is. Italy is doing 10,000 tests per million, South Korea 8,600, Canada 6,800, the USA 3,800, UK 2,600, and India is just testing at 50 per million. So hence again the question as to whether India's low numbers are because of low testing. Joining us tonight on the show, we have with us Dr. V.K. Paul, member Niti Aayog Health, someone who's one of the point persons for this government in overseeing India's strategy for the coronavirus. Also joining us is Dr. K. Srinath Reddy, President Public Health Foundation, someone who's also part of the expert task forces set up by this government. We have with us Dr. T.P. Lahane, Director Medical Education and Research, Maharashtra, who is spearheading the Maharashtra government's effort to contain the disease. Also with us, Dr. Jayaprakash Mulial, ex-principal CMC Vellore and a leading epidemiologist. Great to have you back. And last but not the least, Shamika Ravi, Director of Research, Brookings India, former member, PM's Economic Advisory Council. Dr. Paul, if I could just start with you now, just to look at where we are today, at this crucial midway juncture in the lockdown, we are seeing the numbers increase, we are seeing the doubling rate increase. Are you worried?
Well, let me answer this question by adding additional data to what you already described.
Yes.
Around March 23rd, there was an inflection point downwards in the doubling rate or in terms of number of cases.
Okay? Right.
Prior to March 23rd, the doubling rate was moving in the direction of 3.5, which was a very bad trajectory because that trajectory was taking us to what happened in Europe.
Right.
Around 23rd, which means things that we did on March 12th or so,
yes,
it started to decline and it moved in the direction of doubling every 5 days. A very distinct change happened, and
yes,
mind you, that was before the lockdown.
Right.
That's very important for us to understand.
Right.
That when we take specific measures, travel restrictions, school closures, social
Sure.
distancing movement, things change.
Right.
Then it was moving in this direction till about 31st or so, when Tablighi cohort happened.
Yes.
And yes, we see a spike which is going up, and you very rightly described it, that we lost that from 5, we started to move toward 4 and so on.
Yes.
Now remember, these are the perturbations that you see which are still prior to lockdown. These are pre-lockdown results even today.
Oh, even now it's pre-lockdown.
If you believe in the principles of epidemiology and
yes,
how epidemics happen,
yes,
we now expect, I guess today, tomorrow, day after, we start to see a distinct change, because lockdown, which means the social distancing at its maximum possible, has been now instituted starting on the 25th midnight.
yes,
We should see a very distinct change in the curve tomorrow onwards. And also remember, that even Tablighi incident
yes,
is essentially pre-lockdown phenomenon.
yes,
And therefore, I am not worried as of now. I wish such a clustering had not happened. We should have been cautious.
of course.
But the true effect of lockdown, which will help us to plan our strategy further and to reassure the nation how things are moving in true sense, should emerge in the next 2 to 3 days.
Right. Okay, that's something what you're saying is very interesting. You're saying, and I mean completely fingers crossed on this, that from tomorrow onwards, we should start seeing some kind of reduction of the curve, because sufficient time would have passed for people who then would have found themselves positive within the period of the lockdown to start surfacing. And also, in a sense, the Tablighi impact may have played itself out. They're still trying to track people, but they may have played themselves out. Shamika, would you agree with that assessment, or do the numbers worry you?
Well, the numbers worry for just the magnitude and the trajectory. It's a relative statement that Dr. Paul is making, and I completely agree with it, that in fact, Vasu, if we were growing at the early trajectory pre-March 23rd, today our numbers would have been about 11,000. Okay?
Right.
So everything in terms of policy that the government will bring about and everything that we miss, like the tablighi, will show up in the aggregate numbers.
Right.
But I do suspect over the next few days, the impact of the lockdown, which I do think will be very significant, will begin to show up in the data.
Okay. Let's really hope so. Professor Srinath Reddy, your assessment,
Yes. Well,
your assessment of the numbers and what they tell us.
Okay. First, let me tell you, there is a fallacy in the way these numbers are being interpreted.
Okay.
The more tests we do, the more cases we are likely to find.
Yes.
That doesn't necessarily mean that the infection is spreading faster.
Okay.
It only means we are detecting more cases.
Right.
In fact, if we get more liberal with our testing in terms of numbers, and if we get more liberal in terms of the criteria by which the tests are applied,
Yes.
and we are mostly trying to find the positives rather than trying to exclude the negatives, because
Okay.
that's what sensitivity is about,
Right.
we will actually see the doubling rate increasing quite dramatically. If your number of tests are going up, the doubling rate will actually shrink. That doesn't necessarily mean that it's actually accelerating epidemic. On the other hand, only when your testing numbers are the same and your testing criteria remains same, then the doubling rate has a certain significance.
Okay.
But now we are introducing more tests, more relaxed our criteria. Second thing, mortality. Even there, unless you have a clear idea of how many people have been infected and what age groups, I don't think we should just go by the number of deaths. Italy appears to have a very high mortality.
Yes.
But when you take the age standardized mortality, because they have a much older population,
Yes.
actually those rates are not entirely different from China, not very high anyway. Therefore, you have to adjust for age, you have to adjust for the testing numbers,
Okay.
you have to adjust for the testing criteria before we start jumping to conclusions.
Okay. Okay. But simplify that for the ordinary viewer who's watching this, wanting to get some sense of what this means. Are you saying in simple terms that overall we shouldn't be, we should be vigilant and we should test more, but we shouldn't be too anxious? Are you not
Yes,
saying
I'm
that?
saying that. No, I'm saying that particularly because if the lockdown ends
Yes.
and we start testing very liberally,
Yes.
both with the conventional PCR test as well as with the rapid test,
Right.
we are definitely going to discover many more cases.
Okay.
That means that actually you're then going to see the doubling rate actually shrink.
Right.
Not because the virus has become suddenly more infectious, that's because you are uncovering more cases.
Okay.
Then if the doubling rate falls from 5 to 3, I'm not going to get panicky about it. I'm going to rather watch the serious acute respiratory infections who are actually getting admitted in the hospital
Right.
and seeing whether that number is jumping up quite a lot.
Okay. Which actually, I'll come to Dr. Paul on this, the government continues to maintain is not happening. But let me just bring in Dr. Mulyal, because Dr. Mulyal, the last time when we spoke, you said that even though the government keeps saying there is no community spread, that the disease is not spreading to people who may not have been primary sources of infection, even though the government still says that, you have said that it is assumed that when you lock down of this nature, there is community spread. Now, when you look at the numbers, you also look at the cases that are coming up. What is your assessment?
I think the virus has established itself in the country and it will run its course, and that's the way these viral epidemics work. So I don't be distracted by the fact the proportion diagnosed as positives are low. That is not a safe way to look at it.
Okay.
The thing is, this will keep on increasing. A lockdown, continuous lockdown for 6 months is not possible.
Right.
We'll destroy ourselves. So the thing is, we have to plan is, yes, we have understand the disease has taken a foothold. We can't get rid of it. It has to run its natural course. And there, once you make up your mind, your plan, your program will be sensible and useful for the public.
Okay. But when you
So,
when you
go
say
on.
the lockdown can't continue indefinitely, which you're right, it can't. But what do you think then is a more prudent way of going about it? Do you think that after the
Yeah.
14th we should start lifting it because the disease has already taken hold, there's nothing you can do, or not?
See, normally these viral epidemics has a course. It starts moving from person to person till they reach a level where we call it a herd immunity,
Yes.
at which time it dramatically, miraculously stops. The question is how fast we are reaching that herd effect.
Herd immunity.
With herd immunity. This particular level is about 55% in the case of this virus. I am making a mirror of plus minus 10%. But for our example, if we reach 55%, we will have a cessation of the epidemic. That's the only solution. However, that causes mortality. Now, the only weapon we have is the knowledge that the age-specific mortality varies. Young people are relatively safer. Older people are at risk. But so we need to create a situation there is a differential exposure. The elderly are kept away. The workforce is allowed to move in. And that is the only strategy that will work in this context.
Interesting.
Now tell me one more thing that I want to.
Yes.
When I say in Indian context, small percentage of young will die, it doesn't mean small number because we are a large country.
Sure.
When I say a large percentage of elderly will die, it doesn't mean, it means actually humongous number.
Yes.
Now, if all of them come to the hospital, you can't take care of anybody. So stagger it, and that may be the solution.
Okay. I mean, that's what England is trying, and the jury is still out on whether that's working out for them in terms of herd immunity. When you spoke of young and old, I don't know if you've seen the latest, all of you have seen the latest ICMR data, which actually shows that 85% of the cases in India are between the age of 0 to 60. It's only the remaining 15 to 20% which is 60 plus, which seems to be somewhat counter to the conventional wisdom on the disease. But let me just ask you, Dr. Lahane, because you are right in the middle of trying to manage what is happening in Maharashtra. How are you viewing, sir, what is happening in Maharashtra? Because Maharashtra, the numbers continue to be high. Are they worrying for you? And do you think that the lockdown is going to start showing results?
Yes, sir. In Maharashtra, the number is increasing. But when the number is increasing, I think like Dr. Paul sir said, that now from tomorrow onward, the
Yes.
results of lockdown will be there, and I think I am also of the same opinion that this result will definitely show us from tomorrow onward. And whatever the number increased, it is because our testing is increased. Our labs previously were only 3. Now
Okay.
we have got 24 labs in the Maharashtra. We are also testing the people who are having the complaints also. It means if he has got cough, cold, like that also. We are not only testing the contacts and like that. We are testing the people who are having the signs and symptoms.
Okay.
So number of the testing is increased,
many-
and every expert says that when the number of the this testing increases, you
How many are you testing?
Yes.
How many are you testing now compared to how many you were testing earlier?
see, when we started to begin with, we were testing there about 200 to 300 cases.
Okay.
And
Per day.
now today we are testing 2000 cases every day, and per day, and
Oh, that's a
because
big
of
jump.
that the number of the cases, after that also it is only 4% cases,
Yes.
4% are showing positive and all others are negative. That is a good sign, but the tests are increased also in private and also in the government.
Okay.
So we are not worrying for that, and we are just observing for 2-3 days to go, and then the trend will set what is going to happen.
Right. Dr. Paul, the question on everyone's mind that based on this assessment and again fingers every possible everything that you can cross that from tomorrow, if we start to see a flattening of the curve, what happens vis-a-vis the lockdown? There is talk increasingly within the government of rolling it back in a phased manner, not all at once, in a phased targeted manner. Would you advise that as well?
Well, I think this is a very complex issue because the purpose of breaking the transmission chain at least once and for all and flatten the curve is aimed at saving lives, preventing deaths and morbidity of a certain magnitude. That goal has to be kept in mind. At the same time, the economy and the livelihoods, agriculture, all those things are extremely important. It's a very delicate balance that will go into the final decision making. All these scenarios are being discussed, being debated, being evaluated.
What's your view though, sir?
There is some little more time available for us to move forward. But let me say a couple of things.
Yeah.
One, that we must remember that whenever the lockdown is eased, in whichever form, the life for all of us is not going to be the same. We will move to a new normal.
Sure.
Because, as Dr. Mulyal correctly said, the virus is lurking out there. We have bought time, and we have to be ever ready to make sure that A, it doesn't get out of hand, and B, we as a community and individuals and families continue to take protective measures.
Okay,
and that's a very important part. Remember, the one major reason why the flattening of the curve has been attempted is to be able to prepare better. Therefore, this period is now needed for us to be, as a society, to be prepared for the life thereafter, but also for the entire health system and entire government's machinery to be ready to be able to handle the post-lockdown scene in terms of morbidity, in terms of other problems that we may encounter in every sector.
Okay, let me get Shamika in. Shamika, your take on lockdown, what to do?
Well, it will have to be calibrated, Vasu, given that geographically we know that a very large part of the infection is concentrated in under 70 districts. So I think the staggering in terms of lifting of the lockdown has to be geographic, but I think beyond that, I'm a little, I do think we should assume community spread, and aggressively we have started to ramp up, but to say that certain districts don't have the virus, I think it is important to go out and do this stratified random sampling to then rule out the fact that there is some form of infection, right?
Right.
And then sending people back on the shop floor will require some degree of screening. So, mass production and availability of masks, the basic social distancing norms, a lot of these things will have to be continuously reinforced.
Okay. Professor Reddy? Your take on easing the lockdown?
I entirely agree.
Yes.
Okay, I entirely agree that this should be staged, and then we must ensure that we build up our capacity of both the health system as well as the social systems to deal with it, and ensure that the hot zones hotspots are really located and sealed off, and others monitored closely as well. Well, Vasu, I'm a cardiologist. So after a heart attack, you don't delay the rehabilitation too long, but at the same time, you don't jump into full activity at the same time.
Right.
You have to do it in a stepwise manner. And that's how exactly the society will have to come back. We can't allow our children to remain away from schools for too long. We can't allow our economy to stagnate for too long. But these steps will have to be taken carefully, keeping public health as the primary consideration, but at the same time, easing people back into lives and livelihoods. And at the same time, identifying hotspots, increasing the testing, isolating cases, and that's how we need to combine all of these into one particular strategy of a phased implementation.
I have very little time. Dr. Mulyal, you'd agree with that? That you start rolling back in a phased way?
Correct. I agree with that. Thank you.
Okay. That was short and sweet. Thank you very much indeed, all of you, for joining us.